So we are doing a treatment here with a young Army gentleman here, and he's having some knee pain and some shin splints and some kind of like foot pain. So he just wanted to know how to address it. So for any sort of issues like that, it's usually a tracking issue. So you have to address your postural concerns first. So just like in the video, like where the 4-finger, 2-finger technique, see that, and that'll kind of be a good place to start. But so we already been FasciaBlasting him for about 20 minutes now. I used I prepped with the face, and now I just started coming in and using the mini too, and now I'm kind of showing specific places to poke and wiggle or pay extra attention to. So after we've done just some general fascia blasting, the first areas we want to kind of concentrate on is the peroneal group. So you can kind of already see I already started here. So I took the face right here, just did some prep for a couple minutes, and then I used the mini 2 and kind of just did another minute of prep on the outside here. Okay, so what we want to do is now we're just going to follow the peroneal muscle group and the tibia anterior, and we're just going to poke and wiggle it. So I start at the top of the tibia right here, and I'm just going to follow it on the outside, so just a little bit lateral, and then I'm just going to lightly poke in there and wiggle. Okay, not pushing crazy hard. Okay, just poking. Okay, this will be great for shin splints, any sort of knee pain, ankle pain, plantar fasciitis, anything like that. You can kind of tell it's a little more thicker down here. He's starting to have a little bit of adhesion, so I'm going a little less, but still poking. Okay, there we go, just like that. Okay, just follow it all the way down. You don't want to kill the patient, just kind of nice and easy. See, it's a little bit more difficult when you get closer to the ankle because those tendons are really small, so just be careful. Just nice and easy. There you go. Okay. And then I'm going to start up, and now I'm going to follow the peroneal. Okay, so start at the fibular head right there. I'm going to go down right in between the two muscle groups here. So just nice and easy. Start at the fibular head. Just poke and wiggle. Okay. I'm just following the tension, nice and easy. How's it feel, patient? Good. Okay, so it's a little more adhesed down here. Hurts a little bit more. So just go a little less. We don't want to kill him, but just be effective. Okay. All the way down to the ankle bone there. And now I'm going to go right behind it. Last one. So kind of follow one between the peroneals and the calf. Okay, so backside of that fibula. Just poke and wiggle. You okay? So just following that tension. Just like that. Okay. Does that feel any release or anything like that? Right?
Feels pretty warm. Feels good when you stepped away.
Feels warm?
Oh, it felt like super.
Okay. And kind
Yeah,
of.
you're gonna feel it feel open.
And I want you to kind of go. The tendons stop right above the ankle, so that's where you need to go. Okay. So that's for the lower leg. So what I want to do is I want to follow that up and get to the IT band and top of the quad muscle here. So just obviously make sure he's already been fascia blasted, so make sure it's a fascia blasted area already, so you can help loosen up the tension and superficial layer. Okay. So we'll just give it a couple strokes to re-warm him up. Okay. A lot of knee pain and shin splints, plantar fasciitis, it's a compensation issue, and the IT band and the quad can start to get really adhesed right here. So the quad's right here, IT band's right here, and they kind of just start to get glued to each other. So using the FasciaBlaster kind of helps get their separation and get them working more effectively. Okay, so I'm just kind of re-emphasizing. Okay, you can take the two claws here and kind of just work in between the IT band and everything. Right there, IT band and the quad. Okay. So I'm taking these two claws and just kind of working that. Okay. Next thing, I'm just kind of going right on that IT band with these two claws. Okay, just like that. Perfect. Okay, now after doing that for a couple minutes, I'm going to go back and do the poke and wiggle. Okay, so I'm going to start at the other end of the fibula. So right here, I'm just going to go up towards it right here. That's the IT band. So I'm going to start right there. And I'm just going to go up that way. So just nice poke and wiggle. Okay, just follow that line right through there. That IT band's really tense, so just be careful with it. It's just lightly poke. Okay, lightly poke and wiggle. There we go. All the way up. You okay? So he's got some good tension up here. Okay, so we're following it right up to the hip bone right there. Now I'm going to go up this way, follow it back down. Okay, just nice and
So
easy.
you were kind of on the posterior border of the IT band, now you're on the anterior. Or the bottom versus
Yeah.
the top.
So now I'm just in between those quad and IT band,
Quad and IT band.
and I'm just following it, just doing a little bit. Okay, this is still a more advanced technique, guys. More advanced technique. Boom. So that's how we would treat that. And now I'm going to go back and do the rectus muscle here. Okay. So same thing. We're going to take the top of that from the top of that hip bone. We're just going to kind of put one thumb length difference, and I'm just going to hold it right there. Okay. Same thing. Relax for me, patient. There we go. Okay. So if they're really sensitive or a new patient like this young man, okay, it could be ticklish. So instead of using the actual nugget end, you can use the softer end of the Mini 2 or any of the full size claws. Okay, I'm gonna just kind of stabilize right here. Okay, and I'm just gonna push right on that spot. So we're doing a thumb length from the top of the hip bone. Okay, right on that spot. Just relax for me. Okay, and I'm just doing some nice poke and wiggle right there on that spot. Okay, not too bad.
With one claw.
With one of these guys right here. So the more advanced patients can take a nugget right there, but he's fresh, and it's just going to cause him too much spasm and tension. So I'm just using the other end of the claws. You can hear him laughing. It's okay. Okay, so I'm just taking one claw and going right there. It's best to be done on the skin.
Yeah. See how you're doing that.
Okay. But if they're in sweatpants or can't show their skin, this is still okay. Okay, there we go. Okay, so I would do, that's just some added techniques to kind of help with plantar fascia treatment, medial knee pain, shin splints, any sort of patellar tendonitis, anything like that. Try using some of these techniques and it'll help with your treatment.